Hello, everyone. Greetings for the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infections can look like a rash, can be itchy and annoying. Antifungal medications treat fungal infections. Antifungal medicines can kill a fungus, or they may stop it from multiplying or growing. There are several classes of antifungal medications and different types of medicines. So let's connect today with our skin expert, Dr. Anita Jain, live from Guwahati, to enlighten us on the topic of antifungal. Dr. Anita Jain is a qualified dermatologist and cosmetologist in Guwahati with considerable experience in the field of dermatology and cosmetology. She has a very humble behavior and treats her patients with the utmost care. She has many satisfied patients from all socio-economic strata, several societies, socialites, not only in Guwahati, but also from other cities of Guwahati or Northeast India. Dr. Anita Jain holds degree in MD dermatology and venereology. She is consultant dermatologist and cosmetologist trained in aesthetic dermatology and lasers, Guwahati. Today, Dr. Anita Jain will share her expert views with us on antifungals. So, welcome, ma'am, to today's platform. Our first question for you, doctor, would be who is at risk for fungal infections?
Hello everyone. So this question is very common. Basically, everyone want to know about this. Ki who is at risk? Basically, there is no particular patient who is at risk. All of us are at risk of basically fungal infections. This is so because in our area, basically northeast, we have very high humidity. Because of that, people sweat a lot, and sweat is a very good culture medium for the fungus infection. So that is why we are all at similar risk for fungal infections.
Right. Well, as we now know that we all are at risk for fungal infections, doctor, our next question for you would be, what do antifungals treat?
Basically, antifungals they work against the fungal infection. The people who are having fungal infections, they should go to a dermatologist, and then they should ask for treatment about that. And for this, we have a wide range of antifungals with us, which will treat their fungal infections. We have both oral medicines as well as we have the topical ones to treat the fungal infections nicely. For the antifungals, we have the oral medicines as well as we have the topical ones. Among the oral medicine, the most common antifungals that we use now is itraconazole, that is most commonly used for treating fungal infections. Previously, terbinafine and fluconazole were also used, but nowadays people have become resistant to them. So we preferably use itraconazole, and we have various formulations of itraconazole like super bioavailable itraconazole or the regular ones. So we can use either of them depending on how infection is there, how much infection is there. Also, we have topical agents like we have luliconazoles, we have other antifungals as well, like amlodipine and ibuconazole, naftifast nowadays are there. So we have a wide variety of treatment modules for treating fungal infections.
Right. Doctor, how does this antifungal medications work normally?
Like first we start, we see how much is the infection. If the infection is very little, like only a small area is involved, we then start with the topical ones. So we have to apply the topical creams and ointments that we are given for the fungal infections twice daily, at least twice daily, so that it covers all the 24 hours, like once in the morning and once at night. And they act against the fungus, like some are fungicidal and some are fungistatic. Basically, some kills the fungus or some makes the fungus dormant so that they do not act again against us. So we have the topical ones, also the oral ones. They are both divided into two groups, like fungicidal as well as fungistatic. This is how they work.
Right. Uh, Doctor, well, now we are knowing about the treatments available for fungal infections. But during the first stage, how does one know if it is fungal infection or any mild rash or maybe just a normal skin enlargement? How does one know if it's
Yeah.
actually a fungal infection?
If it is a just a starting of the fungal infection, it will be like annular rash, basically round like rash will be there. It will be little red in color, and then like centrally it will be spreading peripherally. The central part will be clear, and the periphery will have the rim about around the annular lesion. This is how the classical fungal lesion looks like, and it is sometimes associated with itching. Like most of the times people complain of itching, but it may be asymptomatic as well. But the annular lesion, and especially in the areas where we sweat a lot, like the folds, the flexor areas, so in those areas predisposed patient who sweat a lot, then they can suspect of having fungal infection.
So, doctor, just is sweating the only reason, or there are any such reasons for which we are suffering with fungal infection? What are the
Yeah,
rest of the
the
reasons?
other things are like accumulation of water, basically after bath, when we don't clean our folds properly. Like in the flexors, the water accumulates. We have to clean it, wipe it very nicely with the towels. But people tend to avoid, do fast forward wiping of their body, and so they don't clean the web spaces nicely. They don't clean their folds nicely, don't wipe it off nicely. So the water accumulates, and that becomes a harbor agent for the fungal infections. Also, this is contagious. Basically, if one person is having fungal infection at home, people who share their towels, who share their soap, who share their beddings, they also may get fungal infection along with them. So that is why it is contagious. So we it's not that I'm sweating, but if I'm using the towel of a person who is having a fungal infection, so I will also have that infection. So these are certain things we should take care. We should not share certain stuffs with others, like the inner garments, the towels, the beddings, the pillow covers. Basically, these are all contagious agents. So we should keep it separately and try to wash it off on regular basis.
So, doctor, can not maintaining a proper hygiene also can a reason behind fungal infection?
Yeah, maybe a little bit is also associated with hygiene, because you don't maintain hygiene, you don't clean your areas properly. So the bacteria, the fungus all start accumulating in those areas. So that is why we have to maintain a good hygiene. We have to clean ourselves very nicely. We have to bath regularly. Some people don't tend to bath in winters. They skip bathing in winters, like in 3 days or
Right.
4 days they bath. So they also get fungal infection. Even in winters, we see certain few fungal infections because they don't sweat, but since they don't clean their areas, so they are predisposed to fungal infections.
Right. So, doctor, we'll quickly move on to the next question, which is, uh, how long do you need to take antifungal drugs?
Like initially, we used to give for 2 weeks, like previously, few years back, but now the fungus has become very resistant. So now, actually, I give at least a 1 month dosage to all the patients who have started fungal infections, and sometimes they are so resistant, like we need to continue for 2 to 3 months. So minimum 1 month is definitely required to clean the fungus basically completely, so that it does not recur again, and sometimes it may extend to 2 to 3 months depending on the resistance of the fungus.
Right. Also, doctor, let us know what are the potential side effects of antifungals?
Yeah, antifungal, since they are given for such a long time, so basically our liver need to be very perfect to take those medicines. So we always try to do certain liver tests, the liver enzymes and all, in the patients before prescribing antifungals for a longer time, because if their liver is normal, then only it can metabolize the antifungals nicely. Their creatinine level should be normal. Their liver enzyme should be normal. The liver and kidney should be intact to metabolize this normal. Because these are the potential side effects, like they may affect the liver if taken on a long-term basis. So we tend to check on regular basis the liver enzymes, which are when a person is on antifungals for a longer period of time. Having it for a 1 month will not do so much of side effect, but giving for 2 to 3 months may cause if their liver is not normal. So a good check on the liver enzymes and the kidney creatinine test basically. So it's a compulsion to if person is given antifungals for a longer term.
Right. Doctor, and please let us know who shouldn't take antifungal medications at all.
Same goes for that. The people who are having certain liver disorders, people who are having certain kidney disorders, so they should not be prescribed oral antifungals. But topical ones can be given to all of them. The topical antifungals are not a harm to any person. Even in pregnancy, we prescribe certain fungistatic topical antifungals also. So there are certain antifungals which are given to all other patients, irrespective of whatever age or whatever thing they are having, whatever disease they are having. But oral antifungals cannot be prescribed to a person who is having a liver or a kidney disease. For that, we have to take care and prescribe only the topical ones.
Right. Well, I can see a few questions coming up from our viewers. Yash Namdev asks, is it okay to stop taking antifungal medications once the symptoms disappear?
No, it's not at all okay because the symptom is only itching. But itching, if disappears, doesn't mean the rash is also not there. Until and unless the skin has become back to normal, absolutely normal, there is no reddish rash or no flakes, nothing. Till then, we need to continue the antifungal medication, sometime oral, sometime topical. Okay, but it's not that being the symptoms if goes and we stop the medicines. It's not that a fungus is completely killed. So we always need to check with a dermatologist, like to show them the lesions, like if it is completely cleared or not, because you may not be knowing that it's completely cleared or not. So it's important to recommend to a dermatologist and see when it is completely normal, completely absolutely looking normal skin, then only we can stop the antifungals, not before that.
Right. Doctor, the next question comes from Ram Sharma, who asks, what are some common antifungal creams?
The common ones are luliconazole and morphine. These are the composition, but the specific brands are different. And nowadays, naphthidine is also given, and ibuconazole is also given. Sertaconazole is given. There are many antifungals in the market, but using good brands is very much necessary. Like luliconazole is given in every other counter, but all the brands of luliconazole does not contain all the properties. They contain luliconazole, but they need to have certain properties to act on the fungus. So using good brands and using dermatology specified brands are very much important. Not taking medicines over the counter from the pharmacy, anything and anything. Okay, so we need to apply very nicely all the anti so that we don't become resistant to all these drugs.
Right. Doctor, the next question comes from Deepak Saxena, who asks, can antifungal treatments be used for skin and nail infections?
Yeah, skin and fungus infection is both on the skin as well as the nail. Sometimes over the scalp also. Okay, so we use antifungal agents for all these areas. It covers everything. Definitely, it will be different for the nail and it will be different for the skin, but we do have antifungal treatments for covering all these areas.
Doctor, the next question comes from Kiran Dey, who asks, soap or body wash, which is better in fungal infections, ma'am?
Anything can be used, soap also or body wash also, but for the soap we have to take precaution, like we cannot share the soap basically. If two persons in a house are having fungal infections, it's better to take a body wash, antifungal body wash, so that they both can share also and use also. But if both want to use soap, they need to take two different soap. If both are having fungal infection also, they cannot share their soap because the infectivity or the effectivity is different between two persons, so they have to use different soaps, or they can use a single antifungal body wash which are nowadays available in the market.
Doctor, any dietary habits which we need to, take with, or anything which should avoid during fungal infection?
Basically, fungal infection is not related to diet, but definitely when you are on antifungal treatment, if you are taking oral treatment also, then it's better to avoid fatty foods, so that it does not affect the liver so much. Okay, keep having normal diet. Normally you can have everything and anything, just stop having oily or fatty foods to avoid having more of gastritis or more of liver issues with the oral antifungal agents.
Right. Doctor, the next question comes from Akansha, who asks, "Ma'am, sour food खाने से fungal बढ़ता है क्या?"
नहीं, फूड के साथ कोई रिलेशन नहीं है फंगल इन्फेक्शन का। आप सार खाओ, आप बिटर खाओ, आप स्वीट खाओ, इट इज नॉट एट ऑल रिलेटेड टू फंगल इन्फेक्शन।
ऑल्सो डॉक्टर, व्हाट अबाउट एप्लीकेशन? हम सिर्फ खाने के बारे में बात कर रहे हैं। अब फंगल इन्फेक्शन के वक्त कुछ अप्लाई करना मना है
या
या कुछ?
वी हैव टू अप्लाई टॉपिकल एजेंट्स एज वेल। ऐसा नहीं है कि खाली दवाई खाने से ही ठीक होगा, दवाई खानी भी होगी, लगानी भी होगी। सो वी हैव टू अप्लाई टॉपिकल एंटीफंगल एजेंट्स, व्हाट आर द क्रीम्स दैट आई हैव ऑलरेडी मेंशन्ड। So these creams need to be applied at least twice daily and very nicely. And there are certain way to apply the creams. Like we have to apply from the periphery to the center so that we do not spread the infection to the other areas also. And always we need to wash our hands after applying the antifungal creams.
Right. Doctor, has sun rays got to do anything with antifungals as well?
No, nothing, not at all. Sun rays are not at all related to fungal infections. But we tend to, the sun rays are important for the clothes. Like we have to wash our clothes if we are having antifungal. We are having fungal infections in our inner areas. We need to wash our inner garments and everything very nicely and keep in sun rays. So because the sun heat, they tend to kill the fungus. We need to wash them also in boiled water if possible. And the sun rays are good for killing the fungus. But for our body infection, sun rays need to no a direct effect of the sun is there.
Right. Doctor, what about water intake? Uh, has it got any role to play for fungal infection?
Basically, we need to take lots of water while we are having fungal infections and we are on treatment because we are having certain drugs also, no? So they get to be metabolized by the kidneys. So water intake should be very nice if we are having antifungal agents. Nothing as such related to.
Right. Well, it was a very informative session with you, Doctor, today. Before we take a leave, any take-home note for our viewers who are watching us right now?
The most important is that don't take over the counter drugs for fungal infections because the pharmacist most commonly prescribes steroid creams. These creams are very much, very bad for fungal infections because they will come down only the symptoms. Like you won't feel itching after applying the steroid creams, and you will think that your fungal infection is getting good, but it's never that. Or never ever apply any steroid formulation on your fungal infections. Always apply only antifungals, the clean antifungals tubes, not in mixed with steroids. Like we have multi combination drugs that should not be used. Only antifungals, either topical or oral, should be used and preferably prescribed by your dermatologist. Don't take over the counter drugs.
Right. Well, everyone, that was Dr. Anita Jain for us. Thank you so much, Doctor, once again for your valuable time. It has been
Thank
quite
you.
an informative session for our viewers today, and we look forward to many more such sessions in coming times. And thank you, viewers, for your excellent
Thank you so
participation.
much.
For more information and updates on skin health and care, stay connected to our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you, and you all have a good day. Stay safe. Thank you, everybody.
Bye bye.